In this next section, we're going to demonstrate an exercise program for the lumbar spine. There are many exercises we could choose. We've selected the ones we're going to demonstrate because they're effective and relatively simple to do. There's three groups of exercises that we're going to demonstrate. First are going to be a set of warm-up exercises to help with flexibility. Next, we'll be doing some more advanced flexibility and stretching exercises. And then we'll do some core stabilization to help strengthen the muscles on the front of the spine and on the back of the spine. To assist in your understanding of the exercises, it's helpful to have a little bit of background with some of the anatomy. In this model of the lumbar spine, this is the front. These are the bones, the discs. And as we look at the back of the spine, these are the spinous processes that you can feel when you palpate your back. As we look at top view, you can see that the spinal cord runs down through the spine and the spinal nerves exit the side next to the disc. In our rehab program, what we're going to try and do is strengthen the muscles that are on the front of the spine or support the front of the spine and the muscles that support the back of the spine, as well as improving the general flexibility of the spine itself. The first set of exercises are designed to help warm up the lumbar spine. Start first by asking the patient to bring the knee up, clasp the hands around the knee, and then pull gently towards the chest. In fact, we call this the knee to chest exercise. You hold for the count of 2, then relax. Perform the same thing on the other side. Have the patient do this 2 or 3 times. For the next exercise, we call it the knee to shoulder. You're pulling across, again grasping the knee, and pulling across towards the opposite shoulder. This helps stretch the hip and the muscles in the back and the buttock region. And again, we do this several times, so we'll demonstrate on each side. This helps really stretch across the buttock area. Okay. The next part of the exercise, have the patient bring the legs up, okay, and feet down to the side. Okay, great. And we just drop the knees off one side to the other. This adds a rotational stretch to the lumbar spine. Again, we do this on both sides, repeating several times. Now we'll demonstrate some exercises to help with the flexibility of the spine. Start first with the pelvic tilt. So have the patient bend the knee, and both knees up. And to demonstrate this, I slide my hand under the patient's back, and then I say, go ahead and push down against my hand. Good. Now push away from my hand. Excellent. And with this exercise, the pelvis should be rocking back and then rocking forward. Okay. You want to drop back, and you hold it for the count of 1, and then forward. Okay. Excellent. This only needs to be repeated 2 or 3 times slowly. You never want to do it fast, and there's no point to doing a set of 25. 2 or 3 passes are sufficient. Now we'll demonstrate how to do it in a side-to-side position. So we just have the patient stretch front to back, and now they're going to stretch side to side. So bring the hip down, and then bring down the other side. Excellent. This can be done 2 or 3 times, similar to the other type of the pelvic tilt. Next, we'll demonstrate hamstring stretching. This is extremely important to the function of the lumbar spine. Typically, we'll have the patient lie in a doorway so that the door is open, the head and torso is on one side, legs are on the other. And then we have them bring their leg up and put it against the door frame. Imagine that my arm is the door frame. And you want the patient to lock both knees, and they may have to adjust their hip down away from the door frame. And you hold this for about 10 to 15 seconds. The muscle will then relax, and the patient can slide their hip down, which effectively increases the stretch on the leg. Probably about 1.5 to 2 minutes on each leg is what it'll take to have an effective stretch. Final group of exercises are designed to strengthen the muscles that support the spine. This is so-called core stabilization. Start first by having the patient do a crunch. To do this, bring the legs up, feet down on the ground, arm behind the neck. Alternatively, the arms can be held against the chest like this, whichever is most comfortable. And then come up about 10 or 15 degrees, hold, and then come down. And then you would repeat this 15 to 20 times, and then you can add to it as the stomach muscles are strengthened. You never want to do a full sit-up. That can aggravate the low back, and the crunch is sufficient to help strengthen the abdominal muscles. In the next exercise, we'll have the patient come up on their hands and legs, hands and knees. This group of exercises are designed to help strengthen the lumbar spine. So we'll have the patient bring their one arm up and the opposite leg back out. You hold and then come back down and then do the other side. And this can be repeated 15 to 20 times. You will get the most benefit from this 10-minute exercise program if you do the exercises on a daily basis, even after your back feels better. The exercises should not be painful. If you experience pain as you do them, discontinue them and consult your physician.